Dr. Tracy Tyson, board certified general pediatrician, and let's talk influenza. Vaccine is out, so I wanted to talk about why we recommend the vaccine, why don't people like it, and what I think might be able to help. So we recommend the vaccination to every person age 6 months and above. There is no one who doesn't need the vaccination because all of us that get it can actually have complications from influenza, and even if we're not super high risk ourselves, it helps protect those that are. So why do I think people don't like the vaccination? I think it's for good reason. I understand where people are coming from, but it's because they don't understand exactly how it works. The influenza vaccination is meant to give you a fighting chance when you contract influenza. It does help decrease your risk of getting it by around 60%. Some years a little lower, some years a little bit higher, but the average is about 60%. So it does have some protection. However, what it is actually meant to do is stop it from causing complications. Because as we know, viruses themselves are not necessarily the problem. You getting a fever, cough, congestion, it's really not an issue. You can get some of those same symptoms from the vaccination, but the issue is the cell damage to the lungs especially. So influenza does not want your upper respiratory tract like a cold does. It wants your lung cells. That is what it is ready to do. It's not going to stop until it gets there. So it tries to overwhelm your immune system. And if you have antibodies to fight it, and you're a strong, healthy person, you can get through it just fine. But if one little thing goes wrong and you don't have the right antibodies, or your body's already busy doing something else, or you have lung disease, it gets down into your lungs, it causes massive destruction very, very quickly and can lead to complications. So recommended for everyone because this can happen to anyone. So while it's only about 60% effective at preventing you from contracting the disease, what it really does well is preventing you from being hospitalized or death. So there is 80 to 90% reduction in hospitalization and death in children and adults. So another common misspell is that it only is going to affect people with chronic health problems, and that's not true either. 47% of deaths in the United States from influenza are in healthy kids. They don't have any other medical problems whatsoever, and I believe that data because that's what I see in my clinic as well. So we really can't cherry pick who gets it because you don't know who those 47% are going to be. But the other aspect to that is if you contract the virus, you can't let it linger for very long because you've had the vaccination. It only lasts for 2 to 3 days and it goes away. You are spreading that to a lot less people. So that's a lot less people in your community who are less likely to contract the illness. Those numbers go down, hospitalization rates go down, deaths go way down. So it's still a big problem. It's a huge issue, especially for people with chronic health conditions. It's something we can do to all protect each other. It is very safe. It is effective for what it is meant to do. It cannot give you the flu. It's been proven over and over and over again. You can't catch a virus from a vaccination, but it can make you feel bad. So I certainly understand when people don't feel good for a few days that they don't get the validity. So if you think about, if I don't feel good for a few days, but that prevents a baby from going into the hospital not being able to breathe, or from a mother who's pregnant not being able to care for her baby, or for an older person to end up on a ventilator, we can all care for each other so much better than that. So I hope this helps a little bit. Remember, it is safe. It is effective. It is a kindness we can do to our community, but it affects everyone. So get your flu vaccination. Ask questions if you have them. Your healthcare provider is more than willing to talk about this. So often what I get in my clinic when I ask people if they want the vaccination is no. Do you have any questions? No. Ask me your questions. I'm happy to help you. Again, personal choice whether you get it, but we all believe it's very safe and effective, and it's really rare to find a pediatrician who won't get the vaccine themselves, won't give it to their children, because we practice what we preach. I don't want my community sick, and I don't want myself or my children being hospitalized or die from influenza. So stay safe this flu season and talk to your healthcare providers. Take care.